Welcome to another episode of Clear Light Connections, where we talk to the people behind the businesses of Bay Area Houston, proudly sponsored by UTMB Health. Special guest today with UTMB faculty is Dr. Keiser, and he specializes in, well, I'm going to ask you what you specialize in. Tell us a little about yourself.
Sure.
I know that you are the health authority in Galveston County at the moment.
Right.
Tell us about your background and what it is you've been doing lately.
Sure. So I'm an infectious disease specialist, and I've spent my entire career diagnosing and treating infectious diseases. For early on, when I started this in the late 80s and 90s, I treated people with HIV and AIDS. And then during a period of my life, I actually traveled to Africa and helped set up HIV clinics. And since 2016, I've been the local health authority for Galveston County, and that really is the chief public health officer. And I'm also a professor of infectious diseases at UTMB.
So, I mean, Pete, you should look familiar to a lot of people, especially if they live in Galveston County, and you've been on TV a lot. You were telling me about an experience at CNN, so you've been getting some national exposure. Yeah. What's it been like? I mean, you've really been put in the limelight.
Oh, it's been a wild ride. And one of the things I've learned throughout this whole thing that I don't talk like most other public health officials, because, I'll give an interview locally and then someone will call me up and said, I saw this interview you gave and you said something interesting. And that happens to me over and over again. So what I find is that I don't necessarily, follow the script that everyone else does, and quite unintentionally. Yeah. And what it does is that, that piques people's interest and sometimes gets me in trouble.
So you're a faculty member at UTMB.
Yes, I am.
We love talking about how it's a teaching hospital. Yeah. And how so many of the doctors seem to come through there and then come back and end up, doing it themselves. How long have you been here, and what's your favorite part of being a faculty member at UTMB?
Well, I've been here since 2008. I actually arrived at UTMB on September 1st, 2008. Okay. 13 days before Ike. I had a week of orientation. I started my job, and then that Wednesday I evacuated, and it was quite a surprise. Yeah. I knew we were going to have to deal with hurricanes. I just didn't know it was going to be that soon. And after having to go through all of the the stuff with the rebuilding and Hurricane Ike, it's really feel like I'm part of the community, and I enjoy being at UTMB, and also being in Galveston and Galveston County. Before I'd always been in big cities, and so being in a smaller community has a lot of advantages, and it's a lot of fun.
Yeah, and let's get back to, obviously we've got COVID going on, and so that's kind of put you at the fore. What was the job like before that? What were your main issues that you were dealing with?
Well, so dealing with a lot of things like tuberculosis and influenza outbreaks. And of course, a lot of my experience was with HIV and seeing that pandemic just kind of roll out. My career actually follows the career of the trajectory of HIV. I started off as a medical student in 1982. And in 1983, they actually announced that they figured out what the cause of HIV was. Mm-hmm. And they said, within 2 years, we should have a vaccine. And we still don't have a vaccine for HIV. So, so I've been able to see things where there's been a lot of struggle. There's been a lot of disruption of the healthcare system, of having to redesign things, of new medicines coming out, of things not working the way we expect them to, and a lot of disappointments, but just keep plugging along and along. And so now we're at a point where if you have HIV infection, we can give you one pill once a day with minimal side effects, and you'll live a very, very long life and die from something else. And you can see a lot of parallels with that in COVID. We're still very early on with COVID. It came on as a shock. The time scope with COVID has been much more compressed. What took, months and years with HIV has taken days and weeks with COVID. But the progress we've made is actually phenomenal. We're at a point now where we have vaccines. They work. It's been a real tour de force of technology, and just being able to see that and then participate in getting them out to people has been very, very gratifying. And now we're actually seeing pills to treat COVID, so you don't have to get in the hospital and get IV medication. And so just in this 19 months that we've been going through this, the dramatic changes that we've seen have been really remarkable.
Yeah, I'm kind of excited to hear that we're getting past just the vaccine talk and that we're actually talking about treatments that, because that to me, that means that puts us further ahead of this. I think that really takes care of a lot of, what we've been worried about. So can you talk about some of those medicines and treatments and kind of let us know what might be coming? And
Sure. So we have treatments that's already been developed. So the first drug that came was a drug called remdesivir. It's an IV medication, and it works for people who are sick enough to be in the hospital, but not sick enough to be on death's door. And there's a very narrow window in which we can use that. And then more recently, these antibodies came out, these IV infusions, and that actually we give as outpatients, and that keeps you from getting into the hospital. And now we're taking it to the next step. Merck has announced a pill. It's about so big, and you take 2 of them twice a day, and take it for 5 days, and it cures COVID. And it reduces the hospitalization rate by half, reduces the death rate by half. And so you can see that things are really changing to the point where probably sometime within 2022, if you feel bad, you'll go see your doctor. They're going to do a test on you to see if you have COVID. They're going to do a test on you to see if you have flu. They're going to do a test to see if you have any other viral infections. It'll probably all be one test by that point. And once you get that test back, they'll go, oh, here, you have COVID. Here's your pills. Go take these for 5 days. If you start feeling bad, you should go to the emergency room or come back. But, you'll probably feel better in a couple of days.
And you and I were talking before the numbers in Galveston County, and it's kind of hard to distinguish the difference between Clear Lake and Galveston County, but they're improving, and you're hopeful.
Yeah, so they're improving really dramatically. We've come off our worst surge, and we've seen the numbers go higher in, say, July of this year than we'd ever seen before. Now, we had as many as almost 500 cases a day. Now, that may not seem like a lot when you compare it to Houston, which is the fourth largest city in the country. But when you consider that Galveston County has a population of 350,000, that's huge. And so we had more people in the hospital than we've ever had before. We had more deaths. Half the deaths that we've had have occurred since June. Half of the cases that we've had have occurred since June. And so this was a really, really bad time in terms of the numbers. The good news is that because this was our third surge, we got very good at handling it. And so you didn't hear talk of hospitals collapsing. You didn't hear talk of not having enough supplies. We've been able to work through all of those issues so that we were able to keep the healthcare system intact. And if you look at where they've had places where they've just had huge death tolls, it's where the healthcare system has collapsed, right? They just can't take care of those people. But we never crossed that threshold. So, really kudos to, the leadership at UTMB for holding all that together and making sure the supply chain was together and having trained staff and being flexible with how those staff are deployed so that we could meet that. But about sometime in September, we just started seeing the numbers fall like a stone.
Yeah.
And it's not really clear why. In other surges, when we've seen our numbers drop, you can usually attribute to something. Oh, the governor imposed a masking order and closed down all the bars and put the restaurants in half. Oh, well, we started vaccinating and we got a critical mass so that the numbers, and then people are being careful. This time, we had already vaccinated well over 2/3 of the county, and we had also, people were at this point not wearing masks and not changing their behavior. So we're not really sure why it dropped down. So that's really good news that it's dropping down, and we're really, really happy about it. The negative side of that is since we're not sure what's going to happen in the future. So we would just caution everybody that it's not over yet. By our best guess, there's still about 95,000 people in the county that have no immunity. And so they're susceptible and they can get sick, and, we're worried about them. And, but we expect to see more outbreaks as we go along. Whether they'll be big or not, I have no idea.
Yeah.
It's just time will tell as we move on.
And so I guess the cases kind of fell off everywhere, right?
Yes,
all at once. So
yeah.
I'm guessing people are still looking into that and trying to figure out,
right.
What happened. Because from what I could tell, life went back to pretty normal really quickly there.
Yeah.
And so it's good that you know, it's collapsed and people are still doing the same things they were doing.
Yeah.
But you're right. It'd be nice to know so that you can get ahead of the
some
next
people
one.
have talked about things like herd immunity, and we've talked a lot about that. And the idea behind herd immunity is that you have enough people that are immune that you don't get spread of the virus. And, you know, initially people were saying once we hit 70% that would be herd immunity. Well, we're at about 70% right now. But we're still seeing some cases. And when we look at countries like the UK and Israel and Portugal and China, you know, they have all had big drop-offs, and now they're having some resurgence again. So, you know, what I think most people expect to happen is that we'll get these bumps. It'll go up and down and up and down. And hopefully the highs won't be as high and they won't be as long, and they'll be shorter and shorter. And as we continue to get more people vaccinated, as we get better therapeutics, that we're getting better at controlling things, we'll see this slowly fade away or fade into the background, you know, where it's kind of always there, but
Like flu. It's always there.
Yeah.
So let's talk about the vaccine. And I don't have the numbers, and I'm sure you do, but the hospital visits and the deaths, what percentage vaccinated versus unvaccinated have you seen over, you know, well, basically since the big rollout?
Yeah, sorry. So far, we've vaccinated in Galveston County about 350,000 people. We've vaccinated about 205,000. Okay. In addition, there's about 50,000 people that have had COVID, so they have some immunity as well. And when you look at people that have been vaccinated, we have had about 1,000 hospitalizations out of 250,000. And we have had 24 people that have died. Okay. And when you compare the rate of getting COVID or getting hospitalized or dying with those people that have had previous infection, what we see is that previous infection does protect you, but not quite as much as getting a vaccine. Okay. So it's about 1.5, 2 times more likely. On the other hand, if you haven't had either of those, you're about 70 or 80 times more likely than somebody who's been vaccinated.
Staggering.
Yes,
Yeah.
it is huge, the difference between the two. So getting vaccinated works. These vaccines work. They work extremely well. They're very effective. They're some of the safest vaccines we've had. And I know a lot of people don't believe me when I say this, but just the fact that you can go online and look this up and just get all those numbers at a snap of a finger, I think it shows you how much we know about that vaccine, say, compared to your usual flu vaccine or your tetanus vaccine or your pneumonia vaccine. That's, there's not nearly as much information about these, and they work extremely well. They're extremely safe.
Yeah, I mean, my wife and I both got vaccinated as soon as we can. She's in the schools, and that's one of the areas where people were most concerned. But that leads me back to we are expecting an announcement soon, the 5 to 11-year-olds. Yeah. Talk to me about that. Like, what's your recommendations? What are you gonna, what are you seeing?
So the Pfizer vaccine has been approved for 5 to 11-year-olds. Well, sort of been approved, right? But we expect it to go through the final approval stages. The FDA is given a recommendation that it be approved. They're having their board meet, I think, tomorrow. And then after that, they have what they call, the CDC has an advisory council on immunization practices, so that'll meet the first week of November. Nobody expects any issues with that. And so we actually expect to have vaccine in our hands probably the second week of November. Now, from what we've seen is that this vaccine it's slightly different than the one that's given to adults. It's a smaller dose. It's about 1/3 of the dose. That was done purposefully. 1, kids are smaller. 2, that there was concern that giving an adult dose might be associated with more toxicity. So that's why it took longer for particularly these younger kids. They really wanted to make sure this was absolutely safe. And so there doesn't seem to be any safety issues with regard to that, but it has a smaller dose. And the really nice thing about this, it doesn't require it to be frozen cold in these minus 20 degrees or minus 80 degrees Fahrenheit.
So much more readily available at that point.
Much more readily available. So what that means is that it's going to be shipped out, and it'll be shipped out to pediatricians' offices. It'll be shipped out, to the health department. Pharmacies potentially can do it. So anybody that's got a regular freezer can get this vaccine and store it.
Okay.
And there's two reasons to do that. One is you want it widely available because, as you've seen, having only one spot where you got to vaccinate a lot of people, that's a lot of work, right? But it also is, when you're vaccinating small kids, can you imagine having to stand in long lines? And, some of them may not want to get vaccinated.
I used to have to hold mine down. So,
yeah, exactly. I was going to say, right? You might have to hold the kids down. You have a mass vaccination site and you hold one down, the kids start screaming, all the kids start screaming, and it's so this makes it a much more natural type of place where, that it'll be just much easier. And we're hopeful that we can get a lot of kids vaccinated very quickly.
Yeah, good. Now let's talk about boosters. I know that's been widely discussed. I think my wife, she's thinking that she's the same age. We're both 50. She's going to do it because I think it's been recommended for teachers.
Yeah, we would recommend it for teachers. Yeah. Absolutely. We make a big deal about there, and there's been a big deal about vaccines in schools and masks in schools and all that. But quite frankly, the people that are the biggest risks are the teachers, not the kids. Kids tend to do okay. Some kids have problems with COVID, but most kids do okay. But it's really the teachers that put themselves at risk. So that's a high-risk population, and we would encourage everyone to get their booster and to go ahead and get it. So again, right now, the boosters have been approved by the FDA, and that includes whether you've had a Pfizer vaccine, a Moderna vaccine, or a J&J vaccine. And the data says right now that it doesn't really matter that much which one you get boosted with. That if you've had it and then you get a Pfizer and you've had 2 shots of Pfizer and then you get a shot of Moderna, that you're going to have a fine response and you're not going to have toxicity. Same with J&J. J&J, most people only got one, so you should get a second vaccine. In fact, we're recommending everybody that got J&J get a second vaccine because it didn't seem to work quite as well. Okay. And then there is some data which suggests that if you got Pfizer or J&J and you get Moderna, you may have a little better response.
Oh, wow.
So there's some people that want to have Moderna. But Dr. Fauci said this morning that, we would encourage people to stick with the same one that they got. So not everyone believes that. Yeah, and there's probably not enough information. But we're certainly allowing people to get whatever it is that they want to get. And at the health department, we have all of these vaccines, and we'll give people the booster. We feel like it's more important to get people boosted than to haggle over. I want this one, I don't want that one type thing.
So we talked about it earlier. You kind of started your career in the AIDS pandemic, and it's been an ongoing thing. But like we talked about, it's no longer a death sentence. People can live, just as long as anybody else. How remarkable has the response to COVID been as far as, the amount of time it took to get a vaccine, the amount of, just the whole thing, like you said, it's such a compressed time frame.
Right. So, so initially with HIV, people knew something was going on in 1980, and it took 3 years to identify the virus. All right. Now, they didn't know a whole lot about that virus at this point. We knew about COVID in January of 2020. Well, that's what was here. We actually knew about it in December, but it actually got in the United States in 2020. And scientists at UTMB sequenced it by March, meaning that they knew every single sequence. And we had a test that was developed here that we started deploying here mid-March.
Wow.
Probably third week of March. Okay, let's. That time frame has just been amazing. That we could even know what this virus is. We know it's different. We know so many things about it, and then being able to say, these are the immune responses that occur with it. These are the type of antibodies you need to make to kill that virus. So literally by April of 2020. Again, scientists at UTMB had tests where they could take these viruses and say, yep, this works, this doesn't. And so they were able to work with Pfizer to help develop the Pfizer vaccine. And that technology also, was used for the Moderna vaccine. And so just being able to take these things and so rapidly identify it and then build therapies to it has been unprecedented.
Yeah, it really has.
It's so the
amazing.
science has been remarkable. The other thing is that there's been a lot of, on one hand, there's been a lot of criticism of the federal government, and some of it very much deserved. But there's also, the feds also allowed changes to be made in the way things have done. And so part of the skepticism with the vaccine development is it happened so fast. Well, does that mean they didn't test it? No, that's not true. But typically what the federal government does is that, okay, you got to do step one. All right, now you've done step one. Now fill out all this paperwork. Now submitted this paperwork. Okay, now that you've submitted this paperwork, we're going to think about it for a long time, and then we'll get back to you before we allow you to go to step two.
Yeah.
And then to step three, and then to step four. This didn't happen that way. It's like, okay, step 1, 2, 3, all at the same time. Let's do, instead of sequential, do it parallel, and then having groups of people overseeing these processes so that things could be developed very, very rapidly. And I have a feeling we're never going back. It's the expectation has now been set. It's just like, telecommuting and all the other sort of social changes that
well, once you realize the federal government can move that fast, you start to expect them to move that fast. And like you said, the scientists did a great job. They reacted rapidly, but I'm trying to figure out which one of those two events, the government acting fast or the scientists, is more impressive.
Well, I think it's a little bit of both. The best way I think to think about this is the infectious disease equivalent of the Manhattan Project. Where they went from nothing to an atomic bomb actually it took them a couple of years. This took about a year to take to the fruition. Again, a lot of the technology for nuclear weapons and nuclear power existed before World War II, but just bringing it all together and allowing those people to do their work unfettered, and to allow them to say, what is it that you need? We'll get it for you, and mean it. That's where you see these things go so rapidly.
Well, I'm hoping one of the side effects here is that people get interested in science again. And it brings a fresh crop of new scientists, because to be a part of something like that would be remarkable.
Yeah. Well, I think it's already happening, and we're seeing a lot of interest in public health, and a lot of students are very interested in what we do. The idea that we're going to try and protect people's health and prevent people from getting sick. And with the funding that we're getting as COVID mitigation, there includes funding for training people. And so a lot of us are very hopeful that this has been the public health equivalent of, say, World War II and the wake-up call that came to the defense establishment, that we're not going to get caught flat-footed again.
Yeah.
So we're very hopeful that as it moves forward, a lot of this funding that we currently have for COVID remains, and we can start doing other things like looking at chronic diseases and diabetes, and really, I think even more important, things that involve community health, because there's obviously been a gap and a trust gap. And a lot of that comes from the fact that people see, talking heads, people they don't know, saying stuff which they don't necessarily understand, agree with, what have you. But if we're out there every day working in communities and have relationships within communities, and then something happens, what's going to happen is that people are going to, look at what's happening in D.C. and they're going to see what they're talking. Then they're going to turn to us and they go, "Is that right?" And we'll go, "Yeah," or we'll go, but they'll trust us. And that's one of the things I think we've seen with COVID, is that people don't care what President Trump says. People don't care what President Biden says. People don't care what Dr. Fauci says. People don't even care what I say at this point. But what they want to know is, what does my doctor say? What does my pastor say? What does my friend say? I have a sister who's a nurse. What does she say? It's that trust factor. The distrust is so high that trust factor has become something that we recognize we have to spend time rebuilding.
Yeah. Well, and you mentioned it, the further you get away from it, like from Washington to Texas to local, it's access to people. And like you said, that's how you build that trust.
Right.
And it's a lot like, I have more of an impact when I vote in League City, because there's fewer, and it just had more control. And I think that's what you're getting at, is you're building those relationships in the community, and that's going to build that trust. So that hopefully the next time something like this happens, we're much better prepared, and there's open lines of communication. Well, Dr. Keiser, it's been a pleasure. And is there anything else you want to tell the audience before we part?
No, I would just encourage people to get vaccinated. I keep saying the same thing over and over again, and I know a lot of people are skeptical and concerned, and I even know parents that have gotten vaccinated themselves, but they're worried about their kids. And I can tell you, don't worry about your kids. Your kids are going to be fine. It'll be good for them, and it's good for the whole community to get them vaccinated. And part of the reason why we've waited so long to get these vaccines for children, I mean, it's 10 months since we rolled them out for adults, right? Part of the reason is they wanted to make absolutely sure that they were safe.
Right. Well, thanks again. I appreciate everything you do out there, and hopefully we meet again under more pleasant circumstances.
Oh, it was a pleasure talking to you. I've enjoyed it very much.
Nice to meet you.
Hello, Clear Lake Area Chamber of Commerce members and Bay Area Houston. If you're a business wanting to expand your customer base, give back to your community, think about the quality of life around Clear Lake area, think about joining the chamber. Go to clearlakearea.com for more information.